Michelle Palma, founder of the Asian Institute of Culinary Medicine. Would like to thank you for joining us in this free webinar this afternoon. So I believe some of you are students of the AICM, and your attendance for the webinar is one of the completions because this is where you can get your CME credits so you can qualify for the certification exam, right? And others here are joining just because they wanted to learn more about cancer prevention and recovery through culinary medicine. Some of you here are also trainees of the Philippine College of Lifestyle Medicine, and we highly appreciate you spending time in learning more about culinary medicine. So indeed, we know that nutrition is one of the most important pillars in lifestyle medicine. I mean, everything is important, but nutrition plays a huge role. And so culinary medicine is one of the modalities that we use to implement this. All right, so this afternoon we'll be talking about cancer prevention and recovery. If you would notice, every time we talk about cancer in our webinars, we have specific focus because cancer discussion is huge and we cannot completely discuss everything in terms of nutrition in just one 30-minute webinar, right? And so for this afternoon, we'll be focusing on some of the nutrients that people are excessively taking, particularly fats, and what kind of fats, because we'll be focusing more on the saturated fat. What in the saturated fat? I will be focusing more on the palmitic acid, all right? And then I'll just be discussing a bit about some of the ingredients that we usually use in the kitchen that can also be used for patients with cancer. Okay, so this is the new face of our website. So I'd like you to visit our website because we have changed it 100%. We have totally migrated to our new website already. So this is what you can see from the new website. And it's still culinarymd.org. Next Sunday, we'll be discussing about fatty liver cirrhosis, and this is an in-person workshop, and this is scheduled in Quezon City. So we'll be talking about how do we reverse fatty liver so that we can prevent cirrhosis of the liver, right? So that's the goal. We know that certain percentage of patients who have fatty liver disease after a certain period of time, and that's after a few years, they may develop cirrhosis of the liver or they may develop hepatocellular carcinoma. So our goal here is what can we do in the dietary intervention among patients with fatty liver disease so that we can reverse this and so that we can help them avoid the development of cirrhosis of the liver. So that will be, I think that will be October 6th. You can actually check out our website so you can see the schedule. After fatty liver disease, we'll be talking about high cholesterol, hypertension, and then heart disease. We'll be focusing more on declogging the arteries. And then, of course, we'll be focusing on how much of a certain calorie we would want our patients to take so that they can avoid further clogging of the arteries, or what's our goal. Our goal would be declogging the arteries, right, and decreasing the inflammation. So we will be talking more about that. Of course, we'll combine how do we manage patients with high cholesterol because we know that's a risk factor in the development of heart disease. And we'll also manage patients with hypertension. Okay. And okay, so after that, we'll be discussing about cancer. And this is an in-person workshop again. That will be November 13th. So there'll be another focus in cancer intervention, utilizing culinary medicine, particularly nutrition prescription. Like I said, we focus on different aspects of cancer management in every workshop that we do. All right, so would like to invite you to grab the upcoming second edition of Culinary Medicine Handbook. So this is coming out in December. You can check out our website if you want to pre-order. Okay, so we'll be talking about cancer prevention and recovery. This is supposed to be scheduled in September 22, but we're doing this today. And so October 6th, we'll be having salad wraps and then dressing. All right, so we know that about 50% of cancers can be prevented, and this is according to the American Institute of Cancer Research. And when you talk about the modifiable risk factors, most of those are basically lifestyle related. And if you can see there, first thing in there is eating well, and it's dietary intervention. Now, before we go further, I'd like to introduce to you the natural killer cells. So, if you're a physician, I know you're familiar with this, but you might be surprised that the natural killer cells can actually be replicated through the dietary intervention, right? So, this is our natural killer cell. What they do is they actually kill cancer cells. So, we know that, well, science has established that somehow all of us may have cancer growing cells in the body, and it's the natural killer cells that's taking care of that for us. Unfortunately, the natural killer cells are and their functions decrease depending on the lifestyle that we have. So usually when you look at literatures, they will tell you that we have about 2 billion circulating natural killer cells in an adult person, right? However, these natural killer cells can be enhanced in number or can be decreased in terms of their functionalities depending on what we do. So here in this study, this is a study among patients who were given berries, so blueberry in particular. So you can look at the equivalent for that in the Philippines. There are mulberries that we have here. There are also other local berries that you can find. But in this particular study, it was blueberry that was studied. So they found out that the number of natural killer cell among patients who were given blueberries actually increased to two folds. So that's about, it became 2 billion this time, right? And this is post running. So why post running? Because we know that the number or the function of the natural killer cell decreases after vigorous physical activity. So that's why we don't want cancer patients to engage into vigorous physical activity. We just want them to be active. Of course, we want them to do moderate physical activity, but not to the point of doing it vigorously, because that will decrease the function of natural killer cells. But in this patients, after the provision of blueberry, even after 2.5 hours of running, they have established a twofold increase of the natural killer cell count and even function. And then another ingredient that was actually noted to increase the anti-cancer capacity of our natural killer cell is actually the basic ingredient we use in the kitchen. That's black pepper in combination with the cardamom. So I'm not sure if you're familiar with cardamom, but that's what we usually use in many different types of dishes, especially Indian dishes, right? It's also used in Mexican cuisine. It's also used in Western cuisine, Scandinavian. Okay, so this is only showing you that most of the, and there are a lot more actually. So in the upcoming webinars, we'll be focusing more on other things with regards to the ingredients we can use for patients with cancer. All right, so here you will see that even if we have a good number of natural killer cell and you take those ingredients from your kitchen that can actually help you with the number of your and the function of your natural killer cell, sleep actually, sleep deprivation reduces the amount of cancer of natural killer cell, and that's really so sad, right? So if you look at this study, a with only 1 night of non-restorative sleeps, let's say you're deprived of sleep for today, that already decreases the capacity of your natural killer cell to about 70%, right? So that's 72% decreased activity of the natural killer cell, right? So that's why, look, here the World Health Organization has already identified poor sleep and circadian rhythm disruption as a potential ground for cancer. So it's considered as a probable carcinogen. Now, you might be asking, what about catching up in the morning? Say you're at the night shift and then you catch up in the morning. So, well, it has been established that disruption of the circadian rhythm is a potential carcinogen or a probable carcinogen, and that's posted by the World Health Organization already. Now, what I want to focus about cancer is cancer mortality is about metastasis. So what we want to discuss here is that we wanted to decrease metastasis. Why? Because we know that when there's metastasis, then the prognosis of the patients go down drastically. Cancer kills because cancer actually spreads. So that's the point, right? So that's why we don't want cancer to spread. So here, if you look at this, among patients with early stage breast cancer, you will see that the survival rate is about 98%. 0.7. So that's about 99% survival, 5-year relative survival rate. But then it drastically drops to 27% among those patients who have metastasized cancer. So our goal is to avoid metastasis by all means. So here in culinary medicine, in nutrition prescription, basically in lifestyle medicine, we know that food is not just calories. These are information. So the molecules that we get from the food that we eat will actually be processed by the body, and then those molecules will become information on how it's going to be processed, how it's going to be affecting the overall outcome of patients with cancer. So here we are particularly targeting the fatty acid receptor CD36, which is found increased among patients with metastasis. So this is particularly a receptor that's triggered or that's actually enhanced or upregulated by the presence of palmitic acid on a high fat diet. Okay, so specifically boosting metastatic activity among patients with cancer. So here there are many studies you can see that palmitic acid actually upregulates CD36 expression, and we don't want that to happen. And look at this. In this study, when they exposed patients to palmitic acid, in just 12 hours, you will see a 50-fold increase of the CD4, the CD36 receptor in just 12 hours of consumption or ingesting palmitic acid, right? So as the name suggests, you will see here PA or palmitic acid is a major component of your palm oil. And this is also found in vegetable oils. This is also found in meat. A lot of palmitic acid is found in meat, dairy products, cheese, cocoa butter, and even olive oil. Olive oil actually composed of 8 to 20% palmitic acid. All right. So now in this study, they're actually asking if we really need to prescribe a low fat and low dairy diet among patients with breast cancer. And basically, they found that those who are consuming a high fat dairy diet actually has higher risk of developing or higher risk of mortality because of breast cancer compared to those who are not consuming the dairy products. And that's not only for breast cancer. It's the same findings that they had with prostate cancer, the same findings that they had with colorectal cancer. So indeed, when we talk about fat prescription among patients with cancer, we want a provision of evidence-based guidelines, right? So in this study, they carried out a randomized prospective multicenter clinical trial to test the effect of dietary intervention to reduce fat intake in women with resected early stage breast cancer. And they received conventional cancer management as well. So what they did was they decreased the intake of fat from 30 to 20. And then the saturated fat intake was also decreased from about 20 to 10. Right. And they were able to maintain that after a year, after 3 years, and then after 5 years. And you know what happened? The outcome was after approximately 5 years of follow-up, those women in the dietary intervention group had a 24% lower risk of relapse than those at the control group. So there you will see that's actually the Women's Intervention Nutrition Study. So this is another study, the Women's Health Initiative randomized clinical trial. So they also randomized here women with breast cancer. And then what they did was they also reduced the fat intake to 20%. And then they increased consumption of fruits and of course vegetables. So in this randomized control trial, they found out that a dietary change may be able to influence breast cancer outcome and of course overall survival. So I hope you're getting the number here. So usually we eat 35% of our calories from fat, right? Most people would eat even more. And so here in these studies are telling us we have to decrease fat consumption, the calories from fat, among patients with cancer, particularly the fat coming from saturated fat, specifically palmitic acid. So here, the good thing is that when we help patients or when we manage cancer patients, and when we decrease saturated fat, when we decrease the overall consumption of fat intake among patients with cancer, it's not only helping them with their cancer, so it's also benefiting heart problems. It's also benefiting hypertension and other condition. If you look at this, this is the overall dietary recommendation for patients with heart disease, the dietary recommendation for patients with cancer overall, and the dietary intervention for patients with prostate cancer. And so, as you can see here, when you manage patients with cancer, you're also helping them manage their heart disease. And so, again, what we are saying and what we are seeing here is that there is a good and observed benefit that's included, and a reduction in breast cancer followed up in this study. And they do not only benefit for their they are not only benefited for cancer, but they also became normotensive. And those who were requiring insulin, they also decreased their insulin requirements as well. So in summary, I have discussed that 50% of cancer death can be prevented through modifiable lifestyle factors. And among men with prostate cancer, heart disease, and other chronic disease remain an important cause of death. And dietary recommendations to reduce risk of heart disease overlap with those for preventing overall cancer death. And then the recommendations for reducing risk of cancer death are generally consistent with a heart healthy lifestyle. And of course, the expression of genes can be influenced by the environment and the lifestyle through epigenetic modification. And of course, what we wanted to consider here is that we want our patients to somehow increase the number of their natural killer cells, right? And of course, I wanted to emphasize here, it's not included in our discussion, but all cancer patients should have a good physical activity. But I've mentioned earlier that vigorous physical activity is not actually recommended for them because it decreases the natural killer cell number. Not only the number, but it also decreases the natural killer cell function. And so lifestyle modification have positive impact on prostate cancer and overall cancer treatment complications as well. And so I want to go back to this slide in here. There you go. And I want you to focus in this, because if this single nutrition prescription has actually proven working among these patients who were randomized, then why can't we try it for patients with the same condition, right? So as I have mentioned, these patients, they put the diet, the calorie from fat down to 20%. So usually these patients, after the food recall, after dietary assessment, they found out the patients are taking about 35%, 30% calories from fat. What they did was they decreased it to 20%. 20% calories from fat, that's what we call low fat diet. Now, how would you know that? You can go to Mr. Google and then ask. Let's say you're gonna eat McDonald's burger. Then you ask Mr. Google McDonald's burger nutrition facts. Then you will see there how much fat you're eating from that one serving of your calories from that kind of food. So when you read the nutrition labels, you also see there how much of a fat you're taking, and the percentage daily value. You can also see there. You can also see there how much you're taking per serving, right? So maybe this is the right time to trace the kinds of calories that our patients are taking. Also us, because you're attending, you will be also you can also apply this for yourself. So just for once, try to calculate how much fat you're taking for the day, and then from there evaluate if you can decrease this. So when you decrease this, we can get a benefit, of increasing the function of the natural killer cell and the decrease of the CD36 receptor, which is particularly enhanced or upregulated when we take a lot of saturated fat, particularly palmitic acid. All right. Okay. So thank you so much for joining us again. We'll try to answer some questions in here. I know that blueberries are pricey, but somehow that was the one available in the studies. I hope there will be more studies that will come out about the local berries that we have. Actually, mulberry is available in the Philippines, but it's the antioxidants and the ORAC value of the antioxidants from blueberries are not comparable to the mulberries that we have in the Philippines. But they also have a lot of anthocyanin, and they are also rich in antioxidant. It's just that the ORAC value is lower. When you say ORAC value, that's the strength and the amount of antioxidants present in the food. All right, so is virgin coconut oil rich in palmitic acid? Okay, so when you look at coconut oil, it's mainly lauric acid. right? It's mainly lauric acid. So lauric acid is a neutral saturated fat, and palmitic acid is also a saturated fat, but we call it a harmful saturated fat. So yes, virgin coconut oil is also saturated fat, but it's composed of the lauric acid. So if you're joining the annual convention of the PCLM, we'll be talking more about lauric acid. We have an invited guest speaker who will discuss about that from the Philippine Coconut Authority, because we wanted to hear about the science of lauric acid. They said in their campaigning that lauric acid should be taken out, from the classification as saturated fat, because they are misled. We are misled that lauric acid is harmful. They actually increase the good cholesterol, not the bad cholesterol, but then they're labeled as saturated fat. How about strawberries? Yes, strawberries has a good number. They have good amount of antioxidants. So there are a lot of studies about strawberry as well, and the ORAC value. But it's just that the darker the pigment is, the higher the antioxidant. So that's just a basic rule that we have. So relatively, blueberry is darker compared to strawberries. And then there are other berries. Actually, in the Philippines, we have bignay. The small berries that we have, they have higher antioxidants and anthocyanins as well. Okay, so what other foods can quickly boost natural killer cells? So I have mentioned earlier the berries, the cardamom, and then the black pepper, combination of the ingredients, and then the herbs and spices that we use in the kitchen. They have a really good amount of antioxidants. Turmeric, for example. In the next series of webinar that we will have, and that will be about cancer, we'll be talking about the effect of turmeric, curcumin, for example, among patients with pancreatic cancer and gallbladder cancer and other types of cancer. Like I said, 30 minutes of webinar is not enough to talk all to talk about all these ingredients that can help patients with cancer. All right, so usually the benefits that you get are from the pigments. So it's not only from the skin, but the pigment of the fruit or the pigment of the vegetables itself. It could be in the meat of the vegetable, or it could be in the skin as well. Pomegranate is also a good is also a good source of antioxidant. Duhat, yes, that has high ORAC value as well. Frozen strawberry, yes. Actually, frozen fruits and vegetables, they are harvested at the peak, of their rightfulness, the right doneness, and it's really good and ripe, and the quality of that is really supreme, right? That's why they are frozen. So somehow frozen vegetables will also give you a benefit. All right. So thank you for the questions that are that are keep coming in, and thank you for other insights that are shared in here. I just wanted to answer one question here. You cannot quickly remove the tumor through food. Okay, so that's why in lifestyle medicine, we combine whatever we can do using the pharmacological intervention and the non-pharmacological intervention. So I hope that's important for you to know, right? So we still recommend patients to go for pharmacological intervention, surgical intervention, if it's really necessary, because we wanted to remove the cancer out of the body, right? And we want to boost immune system of the patient, and so that we can help them survive. Our goal here is survival. We don't want patients to develop metastasis, because once there's mets, and we know that the survival rate drastically dropped down. So as early as possible, we want detection, we want diagnosis, and then we want intervention. And so we want to prevent metastasis so the patient will be cancer-free. Okay. Thank you so much, everyone, for joining us, and we hope to see you again in the next culinary medicine webinar. Good afternoon, everyone, and happy Sunday.